Most opioids are pain medications prescribed for both short-term and long-term pain. They are highly effective but come with many side effects. If you're taking opioids, it's important to speak with your doctor about their proper use and to develop a plan to eventually discontinue the medication safely. Here are 8 safety tips that will help you avoid possible negative side effects and increase safety. Number 1. Always use opioids as prescribed. Taking more than needed may lead to increased side effects, including addiction and overdose. Number 2. Never mix alcohol or other drugs with opioids. Mixing them may cause slowed or arrested breathing, unconsciousness, and even death. Number 3. Never drive or operate heavy machinery while using opioids. Opioids affect the nervous system and may cause dizziness and sleepiness, which could lead to a crash, injury, or death. Number 4. Carefully read and follow the label directions prior to taking the medication. When you get the prescription filled, be sure to check the package to ensure it's the right medication and at the appropriate dosage as your doctor prescribed. Number 5. Store your opioids safely and make sure your loved ones won't have access to your medications, especially teens and kids. Number 6. Dispose of your opioids safely. There are many methods available, including drop-off boxes at pharmacies, law enforcement facilities, and hospitals. You can find a list of these sites on the DEA website or simply by typing "drug disposal near me" into Google Maps. Number 7. Consider buying Naloxone, also known by its brand name, Narcan. In case of an accidental overdose, Narcan can reverse the side effects immediately. It's available over the counter in many jurisdictions. Number 8. Seek expert help when you're ready to stop using opioids, since suddenly stopping may lead to severe withdrawal and potentially life-threatening symptoms. With the ANR treatment, we restore the patient's endorphin system to a pre-addiction state, freeing them from addiction and allowing them to overcome the withdrawals and cravings without using replacement drugs or therapy. We want you to be smart with your opioid usage, and we want to keep you safe.